Hello and thanks for visiting this virtual poster. I am Miriam Lacasse, family physician and assistant professor at the Department of Family and Emergency Medicine, Université Laval in Quebec City, Canada. I am presenting on behalf of our whole team, which worked on the development and validation of an innovative competency assessment tool. Our family medicine residency program aimed at developing an innovative criterion-based online competency assessment tool for in-training evaluation and progress reports. This poster presents the whole development and validation process, summarizing over 5 years of work and at least 3 manuscripts. In 2011, we first worked at developing benchmarks based on clinical teachers' expectations of competency achievement during family medicine training. They were defined using a Delphi methodology with 33 family medicine clinical teachers at Université Laval. Rubrics were then defined for each competency to specify 3 levels of supervision: close, distant, or independent. The tool helps to monitor progression of learning regarding 34 competencies within the 7 CanMEDS roles and identifies whether each competency is developed by the expected time point. For each competency, the black cursor shows when a resident should no more require close supervision but at least distant supervision. The green line illustrates the expected timing to develop independent practice. A resident would be an early achiever if already independent during the blue interval. If distant supervision for a given competency is still required beyond the green interval, the competency development will be considered limit on the yellow interval or delayed on the red interval. In the timeline figure, you can see the validation process for 5 sources of validity: content validity, response process, internal structure, relations to other variables, and consequences of testing. A computerized system was developed to connect the different rubrics, seen as pop-ups, with the expected time points for achievement of each level. It suggests the rotation issue based on the number of competencies identified as limit or delayed. The system is also programmed to identify possible educational diagnoses and suggest relevant educational prescriptions based on a thorough literature review and expert opinions. Pilot implementation of the competency assessment tool was well received. Clinical teachers found rubrics were a strength of the tool to guide them in their reflection and improve the assessment process objectivity. The usability of the tool was also considered an asset. Some challenges were identified. Some assessors feared that the issue proposed by the computerized system would not match their judgment. Others found getting used to the tool was challenging, given some logistical complexity during team assessment, and the propensity of some assessors to assign the same level of supervision to all competencies for a given resident according to their overall assessment rather than each objective criteria. Faculty development and program support for implementation were adapted based on these results. In conclusion, the competency assessment tool may be used as a teaching tool to guide competency development or as an assessment tool at the end of a rotation or periodically as a progress report. While initial results appear promising, a cohort study, which started 3 months before implementation of the tool, will allow to confirm psychometric properties on a larger sample and assess our competency assessment tool impact on residents and faculty. Thanks for your visit.